Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Tests to be done in polycystic ovarian disease. In polycystic ovarian disease, we should do serum testosterone and ultrasonography for diagnostic purposes, thyroid stimulating hormone, prolactin, 17 hydroxyprogesterone, luteinizing hormone, and follicle stimulating hormone. These four should be done to rule out conditions mimicking polycystic ovarian syndrome. Cortisol should be done to rule out Cushing syndrome. Oral glucose tolerance test, lipid profile, and endometrial biopsy is done for risk assessment. Manage
thank you and thank you for watching.